Hello?
Okay, good evening, good good night to everyone on this platform tonight. I take this opportunity on behalf of Yahweh's Kingdom Lifestyle Ministry to greet you in the wonderful name of Yahshua the Messiah. And we take this opportunity to thank you so much for your time. We thank you for allowing us on your tablet, on your cell phone, on your computer, and phones. We say good afternoon. If it's morning, we say good morning. And we thank you so much for allowing us in your sitting room or wherever you are. Thank you for joining us as we have the second episode of this program, Self Care, with our presenter, Nurse Fontenelle. She
Hi.
is, yeah, she is excited to be on the program and she is very intelligent program. And I more of a time, but allow her to introduce herself briefly and allow her to continue with her presentation. You are welcome, Ms. Fontenelle. Thank you very much for taking time out to assist us in this presentation. It's welcome, and we are happy to have you on. Thank you very much. You could go ahead with your presentation.
Okay, thank you. Okay. Okay, so good night, everyone. Thank you so much for tuning in for this session. Thank you, Yahweh's Kingdom Lifestyle Ministry, for giving me this opportunity to present here tonight, to share my knowledge, my experiences, and to teach you about mental health. So let me tell you a little about myself. I am Miss Fontenelle, as stated earlier. I live and work in St. Lucia. I have been a registered nurse for almost 8 years now. I hold a bachelor's and a master's degree in public health, and I enjoy teaching, discussing, socializing, and having fun. I run a blog about tropical living. It is ourtropicalliving.com. And I also have an inspirational YouTube channel. It is also a blog, and the name is Rim Sonson. So you could subscribe to my YouTube channel, Rim Sonson. You could follow me on Facebook as Our Tropical Living, and you can also follow me on Instagram. I go by the name Rim Sonson and Our Tropical Living. So tonight we will be discussing mental health. I hope you can hear. I can hear myself twice, so hopefully you can hear. Okay. So what is mental health? The World Health Organization, that's WHO, defines mental health as a state of well-being in which every individual realizes his or her own potential, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. Mental health includes our social, psychological, and emotional well-being. Mental health affects how we think, it affects how we feel, it affects how we act, and mental health helps determine how we handle stress, relate to others, and make choices. Impaired mental health affects our ability to function as effective members of society, and it also affects our ability to cope with the daily stresses of life. So when I say daily stresses of life, what exactly do I mean? That means being able to deal with being in traffic for an hour, being able to deal with a disagreement with someone, and being able to cope adequately with disappointment. Mental health is very important, and it is important at every stage of life, from childhood to adolescence to adulthood. When we experience mental health problems, it affects our thought process, our mood, and even our behavior. Psychologically, personal factors, biological, and even personality can contribute to mental health problems. So it is important to know that mental health is different from mental illness. Everybody's paying attention? Okay. Mental illnesses are conditions that affect a person's thinking, feeling, their mood, and even their behavior, such as being depressed, anxiety, bipolar disorder, or even schizophrenia. Mental illness could occur occasionally, and it can also occur over a lifetime. So it can be chronic and it can be long lasting. It can affect someone's ability to relate to others and function every day. Although the terms are often used interchangeably, mental health and mental illness are not the same. So a person can experience poor mental health and not be diagnosed with a mental illness. Likewise, a person diagnosed with a mental illness can experience periods of well-being, which could be physical, social, and mental. Our mental and physical health are equally important components of overall health. Mental illness, especially depression, increases the risk of developing stress, self-harm, stroke, diabetes, high blood pressure, and even heart disease. Individuals suffering from chronic conditions are at an increased risk of developing mental illness. And chronic conditions can affect daily living, it can affect quality of life, so it can raise one's stress levels and the ability to cope with the circumstance. Okay, so on to the next slide. Can your mental health change over time? What do you think? The answer is yes. Many factors could affect a person's mental health over time. Sometimes we have so much doing and we go through so much that the demands placed on our body exceed our coping capabilities, and that could negatively impact our mental health. Imagine having to work 12 hours, then coming home to take care of your sick grandmother or to care for a newborn, and you have assignments to do, you have chores to do. I mean, it's a bit extreme, but it happens in real life. And this could send someone into depression and cause poor mental health. I can relate to that because when I was going to school full time and working full time, it was a challenge for me. But thank God for my mom. She took care of the house, she did my chores, she did all the laundry, and she always ensured that I had food to eat. Because going to school and having to come home to do chores, I mean, that can be overwhelming. So, what are the determinants of mental health? Social factors are the conditions in which we live, born, grow, work, and age. It is basically where you live, where you work, where you play, as it relates to our socioeconomic status, our physical environment, and employment opportunities. So if you have poor education and poor socioeconomic status, that could cause poor mental health as individuals try to cope with having low incomes and sustaining themselves and their families. Imagine you in this scenario. You have no educational background, you do not have a decent paying job, and you work in a poor environment. You work at a risky job with poor working conditions. Yet you have bills to pay, you have food to buy, you have to take care of yourself, and imagine having children that you have to take care of also. That could cause someone to have poor mental health. What about the sociological factors? These include our beliefs, motivation, and individual characteristics. Certain personality traits could predispose us to poor mental health, and some individuals suffer from OCD. Do you suffer from OCD? That's obsessive compulsive disorder, where you repeat things all the time, you repeat your actions, and you have a lot of unwanted thoughts. So that could cause poor mental health. What about the biological factors? They too can also affect mental health because of abnormal functioning of nerve cells that connect to certain regions of the brain. Any defect or injury to these circuits can affect mental health. And we see that sometimes individuals with family members with mental illness are more prone to developing mental illness. But you may be more susceptible to developing a mental illness, but that does not mean that you will develop a mental illness. Stressful work environments, unhealthy lifestyle, sexual violence, socioeconomic pressures, violence, gender discrimination, and even rapid change could affect our mental health. Do you work in a stressful environment? Do you deal with stressful focus on a daily basis? Do you have a stressful significant other, or do you have stressful family members? I mean, these could all contribute to impaired mental health if the answers are yes. It is important to remember that there is no single cause for mental illness, but a number of factors could contribute to the risk of developing mental illness. Our life experiences can cause mental illness, such as trauma, or if we have a history of abuse. When I say abuse, I mean it can be sexual assault, child abuse, witnessing violence, Chronic conditions such as cancer could also be a contributing factor. Alcohol and drug use, having few friends and not socializing, having feelings of loneliness or isolation could also be contributing factors. Okay, so what about the stigma attached to mental health? The World Health Organization, like I said earlier, that's WHO, explains that people with mental health conditions often experience severe human rights violations. They go through discrimination and even stigma. I am guilty of such because before I started working in the healthcare field, I was so afraid of individuals with mental illness because I felt like they would attack me anytime or they would just snap anytime and change personality. But over time, as I began working with individuals with mental health conditions, I better understood them and I understood how to react and respond to them. So stigma can cause discrimination, it can also cause ignorance, and it can also cause prejudice. Stigma attached to mental illness causes individuals suffering with mental disorders to feel shame. They may have low self-esteem, and they may also develop negative beliefs. So as a result, this may cause these individuals with mental disorders to withdraw from social interaction. Stigma to mental disorders is a barrier to the provision of care for people with mental disorders. And individuals with mental disorders, they are also ostracized by society. I'm not sure if you are aware of any individual suffering with mental illness. So you could always share your experience. Some communities banish individuals with mental disorders, whereas others get beaten, they get neglected, and they get deprived of basic human needs. Individuals suffering with mental illness may believe that healthcare providers they have stigma towards them, so they may not seek healthcare. This could increase the cases of individuals suffering from mental illness and can lead to poor physical and overall health if it is left untreated. So persons can get depressed further, they can inflict harm on others and even on themselves. So I pose this question to you. How do you feel about someone with poor mental health and someone with a mental illness? Do you avoid them? Do you label them? Or do you define them as their mental illness and not for who they are? What do you do? So together, let us stop the stigma attached to poor mental health and mental illness. Any of us could suffer from poor mental health or develop a mental illness at any point in our life. Sometimes situations happen and they are unforeseen, and that can really change the course of our life. If we don't have proper coping skills and the personality attached to coping well with unanticipated and life-changing events, then we could develop poor mental health. Okay, so what are the warning signs? Do you know the signs of poor mental health? Do you have poor mental health? Although poor mental health could be mistaken for other illnesses, there are many common signs and symptoms that we can identify. So it is important to note that poor mental health could cause varying signs and symptoms, and these all vary from person to person. So what affects you is not necessarily what may affect somebody else. Okay, so the signs and symptoms, do you have inability to perform daily tasks like taking care of your kids or getting to work or school? Do you have aches? Do you have pains of unknown origin? Do you constantly feel sleepy and tired? Do you constantly pull yourself away from people and usual activities? Do you have low energy or no energy at all? Do you feel numb to everything around you or do you feel like nothing matters? Do you have constant changes in your mood, such as feeling helpless, hopeless, or feeling upset? Do you? Do you smoke? Do you drink? Or do you use drugs more than usual? Do you feel unusually confused, forgetful, or on edge? Do you yell or fight with family members and friends? These are all signs and symptoms. If you have severe Mood swings that cause problems in relationships, that is also one. If you constantly have thoughts and memories that you cannot get out of your head, or do you constantly hear voices or believe things that are not true? Do you think of harming yourself? Do you think of harming others? So when was the last time you had any of these thoughts or feelings? Does that mean that you have poor mental health? So what are the ways to improve on mental health? Improving mental health involves activities that can improve sociological well-being, such as counseling. I mean, sometimes individuals might say counseling may not help, but it actually does help. You could seek professional help to help you better cope and to alleviate anxiety. You could engage in backyard gardening, and that's one of my favorite things to do. You could engage in sporting activities to help release stress. You could keep a journal. I love keeping journals. I write down my thoughts for the day, what I want to accomplish, the good things that happened to me during the day, and even the bad things. You could go out with friends, you could connect with others, you could partake in mental health programs to help reduce stress. Group outings, I love group outings. I love to socialize, so that's another one you could do. And these activities serve as a way to provide a sense of belonging to a group or something. And remember, always stay positive, get physically active, try to help others, make sure you get enough sleep, and try to develop proper coping skills. So whether you are or whether you are not suffering from mental illness or poor mental health, anti-discrimination campaigns could be done where you could raise awareness of mental illness and poor mental health. You could encourage the implementation of these laws to help protect all individuals from being bullied because vulnerable groups and those with mental illness are at a greater possibility of being exposed to discrimination. So the laws could be useful. There is treatment for persons with poor mental health and those with mental illness. And many health conditions, that's mental health conditions, can be effectively treated at low cost. But there is a gap between people needing care and those who access the care. Okay, so effective treatment coverage remains extremely low. Increased investment is required for mental health awareness and to increase understanding and reduce stigma. So remember, positive change starts with you, so you could help improve someone's poor mental health. Or if you have poor mental health, then you could try to improve on ways so that you could have increased mental health and overall good quality of life. More efforts on the part of the government could be done to help increase access to quality of mental health care and even effective treatments. Research could be done to identify new treatments and to improve existing treatments for all mental health disorders. And research on what has worked in the past could be utilized to enhance future interventions. So what about raising awareness? I'm always for prevention. I know that mental illness and poor mental health could be inherited. So parents could be taught signs and symptoms of poor mental health and mental illness for early diagnosis and treatment. And I believe that mental health should be taught at all schools. So children could be raised into knowing the signs and symptoms of poor mental health and mental illness. This would help with early identification of signs and symptoms and to help ensure that help is obtained. Individuals with mental illness and families can be empowered, and educational programs on mental health could be done in communities. This will help raise awareness of mental disorders, its risk factors, and coping methods to utilize when dealing with people with mental disorders. And that could be useful to help reduce stigma attached to mental health. Individuals with mental illness to be protected from the harms of society through legislation on human rights that ensure they are effective members of society. And I know that some individuals may disagree with that, but laws that promote liberty of individuals with mental illness and support integration of individuals with mental illness into the community could be done. I mean, imagine it's you. You have a mental illness. Wouldn't you want to be a part of society, be a part of your community, and just try to be a better person? So a lack of services for mental disorders in low-income countries affect the healthcare system, and that in turn affects us all. Psychiatric disorders that go untreated affect patients, they affect families, affect communities, and they even affect the healthcare system. So individuals with mental disorders in low-income countries, they may not have access to healthcare system because mental health is not seen as a priority. Therefore, more mental health care education can be done, especially by healthcare workers. So mental disorders affect overall health, it causes disabilities, and it can decrease on the years we live. Mental health services should be introduced into primary care services just to help improve the outcome of mental health. As the slide says, we can do it. So remember, you could have poor mental health and you could not be diagnosed with a mental illness, and you could remain capable of contributing to society, and you could live a healthy and a normal life. So as we see in the diagram, we can see the risk factors and the protective factors. So if a child has low self-esteem, then family members, parents could increase on their self-esteem and give them good social and emotional skills. For family members who are dysfunctional or family members who break up or parents with mental illness, then the family should try to be in harmony and have stability with each other and have strong family values. For schools, individuals can feel rejected from school, they can feel like they are a failure, and they can have a poor connection to schools. So a positive school climate can be created to enhance belonging and a sense of connectedness. For life events, sometimes we have death of a family member, and that's me trying to cope with my mom's death right now. I am emotionally traumatized, as you can see in the diagram. So it is important to have a good support at critical times. For social, we can sometimes feel isolated and we can feel like we are being discriminated against, but we can participate in community networks and have strong cultural identity and pride. So we can contribute to our community, to contribute to our country, and just to contribute to the world at large. Any questions thus far? Okay, so thank you so much. For being a part of this presentation. Mr. Yahweh.
Okay,
I'm listening.
we thank you very much, Ms. Fontenelle, for such short and sweet
That's me.
presentation. Yeah, S and S is an S and S presentation, short and sweet. We thank you very much for this presentation, and you since you have to go, we cannot keep you any longer, and we look forward to be having another wonderful presentation like that with you in the next 2 weeks. So our fellow listeners, please remember that it's every 2 Wednesday, every first and third Wednesday of the month, we are having Miss Fontenelle with us to give us some very exciting sessions. And we thank you very much, Miss Fontenelle, and we pray that the Heavenly Father guide and protect you. You have to leave for work, so we pray for traveling mercies on your behalf.
Thank you. I
And
appreciate that.
Yes, and thank you very much.